Open any article or watch any item covering artificial intelligence in healthcare on the news, and the chances are that you will be greeted with an overly positive narrative promoting it as a cost-effective and essential tool for improving lives. What could be the downside? But this narrative conceals a much more nuanced reality in which major risks exist, including bias and discrimination. This has the potential to harm patients' health, infringe on their fundamental rights, and exacerbate already existing health inequalities. The one-sided, often industry-driven narrative, when adopted by policymakers and politicians, can mean laws and regulations inadequately reflect the risks of health AI. Organizations like Health Action International have an important role to play in ensuring that both sides of the story are heard, so that the policies reflect the realities and that AI innovations in health have a benefit across society, not just for certain groups, and that they respect patients' rights. For example, not to be discriminated against, give informed consent to treatment, and receive high-quality care. We do this through evidence-based advocacy, speaking to decision makers at various levels of government, as well as organizations including the European Medicines Agency. But another essential part of this is making sure that the media narrative around health AI is balanced so that articles we read and the news we watch are informed not just from an industry perspective, but from a patient rights and safety perspective too. We write op-eds and we talk to journalists, whether one-on-one or through wider briefings, like one we held in Amsterdam this October, during which our experts were able to lay out the evidence, explaining where the risks in AI and healthcare lie, and giving recommendations on how to counteract them. In doing so, we contribute to a changing and better balanced narrative so that those policymakers and politicians are given all the necessary information needed to formulate policies and regulations that promote innovation in health AI that is in the greater public interest and protects patients' rights.